Pancreatitis can happen on these drugs. It is not the side effect most people will get. With Ozempic, semaglutide, and Mounjaro, tirzepatide, the danger is not that this is common. The danger is that severe pain can look like a routine stomach reaction at first. Then the pattern changes, and the pain starts feeling different and more alarming. Most stomach symptoms on these drugs are not pancreatitis. Nausea, early fullness, burping, and vomiting can happen because these drugs slow how fast your stomach empties. That overlap is why some people panic too early while others wait too long. The first thing to understand is simple. Common side effects often move with meals, dose changes, or the first weeks of treatment. Pancreatitis pain usually feels deeper, steadier, and much harder to shrug off. I'm Dr. Kim, a licensed physician. This is not medical advice. Consult your doctor. Your pancreas is a gland behind the stomach. It helps digest food and helps control blood sugar. When it becomes inflamed, the problem is not just irritation. The organ can start injuring itself, and that can become serious fast. That is why the official drug label for both drugs treats this as a warning. Patients are told to watch for persistent or severe abdominal pain. That pain may go through to the back and may happen with or without nausea or vomiting. If pancreatitis is suspected, the drug should be stopped and medically evaluated right away. So is this a real risk or a rare headline? The cleanest answer is this. It is real, but it appears uncommon in studies. That is very different from saying it is imaginary. In Ozempic studies, 7 treated patients developed acute pancreatitis. In Mounjaro studies, 14 cases of acute pancreatitis occurred in 13 treated adults. These were still uncommon events in the studies, not something most patients experienced. People in the non-drug comparison groups also had a small number of pancreatitis cases. So this is not a problem that exists only inside one drug label. The more useful point is that the risk is real enough to take seriously, even if the total numbers stay low. Those are still low numbers, but low does not mean zero. It also does not mean every severe stomach symptom on these drugs is just a routine adjustment effect. The more dangerous mistake is assuming every later stomach symptom is just more of the same. Some people feel reassured because they already had nausea on these drugs. Then they start treating all future pain as routine, even when the pattern has clearly changed. The pattern change matters more than the drug name. If discomfort is mild, meal-linked, and improving, that fits common stomach side effects more often. If the pain is severe, steady, or unusual for you, stop treating it like a routine side effect. Deep upper abdominal pain deserves more caution. Back pain makes people especially nervous, but it is not a magic sign by itself. The label warns that the pain can move through to the back because pancreatitis can feel that way. Still, the more important clue is severe persistent pain, not one body location by itself. Vomiting also does not settle the diagnosis. These drugs can cause vomiting without pancreatitis. Pancreatitis can happen without vomiting too. That is why symptom pattern beats any single symptom taken alone. That is why a single clue can mislead you. Many viewers think that if symptoms start after a dose increase, it must be a routine stomach reaction. Dose increases do raise ordinary stomach side effects, but timing alone cannot safely rule pancreatitis out. Food can mislead people too. A heavy meal can trigger ordinary nausea, reflux, or gallbladder pain. That does not prove the pancreas is fine. It also does not prove the pancreas is the problem. Gallstones complicate this picture. Rapid weight loss can increase gallstone risk, and gallstones themselves are a classic cause of pancreatitis. So sometimes the drug is part of the story indirectly. The drug may not directly inflame the pancreas. But rapid weight loss can change the gallbladder and the digestive fluid called bile. That distinction matters because viewers often want a simple answer. They want a clean yes or no. In real life, medicine is often less neat. A drug can raise the chance of a problem without being the only cause. That is why the same symptom does not mean the same level of danger. Some people just have the usual slowed stomach emptying and get better with slower eating, smaller meals, and time. Other people develop a pain pattern that keeps building or stops feeling like a meal issue. That second group needs medical evaluation, not more trial and error at home. Some situations are not safe to monitor at home. Pain that is severe, does not let up, keeps building, or clearly feels different from your usual nausea pattern deserves prompt evaluation. Repeated vomiting, weakness, sweating, or pain that makes you unable to function normally lowers the bar for urgent care even more. Do not try to settle this at home with internet checklists. The main question is whether the pain has crossed the line from routine side effect to something more dangerous. Severe or persistent upper abdominal pain deserves prompt medical attention. That is even more true if it feels different from your usual side effects or pushes through to the back. And no, you should not keep taking the next weekly dose just to see whether the pain settles. The official drug label for both drugs says to stop the drug if pancreatitis is suspected. If pancreatitis is suspected, the safer move is to stop the drug and get evaluated. What will doctors do after that? They will look at the whole picture, symptoms, exam, blood tests, and sometimes scans. A lipase blood test can come back high when the pancreas is inflamed. It can help, but the diagnosis should never rest on one number alone. Normal testing early on can also confuse people. Some viewers hear that one blood test was not dramatic and decide the danger is over. Doctors look at the whole situation, your symptoms, exam, blood tests, and sometimes scans, especially when the pain still sounds concerning. This also explains why emergency departments and clinics do not rely on internet symptom lists. Severe abdominal pain can come from several different causes. Pancreatitis is one, gallbladder disease is another, so are stomach ulcers, bowel problems, kidney stones, and sometimes heart problems that show up in unusual ways. If pancreatitis is confirmed, the next question is usually whether the drug should ever be restarted. In general, the official drug label says that if pancreatitis is confirmed, the drug should not be restarted. That is another reason this cannot be treated as just another rough stomach week. Even after the drug is stopped, people often assume the danger should disappear right away. Not necessarily. These drugs last a long time in the body. That means ongoing symptoms still deserve real follow-up even after the pen has been put away. This is also where prior history matters. Ozempic has not been studied in people with a history of pancreatitis. The official drug label says it is not known whether it can be used safely in those patients. That does not automatically make the drug forbidden in every case. But it does mean the decision needs more caution and a careful discussion with a doctor. So the honest bottom line is this: pancreatitis on Ozempic or Mounjaro is not the common explanation for every stomach complaint, but it is real enough that you cannot brush off a severe new pain pattern. Rare is not harmless when missing it can matter. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.